The Yale University Budget Lab's recent analysis has uncovered significant implications of the proposed Republican budget plan, revealing a dramatic pattern of wealth redistribution that would fundamentally reshape America's economic landscape. This comprehensive study, conducted by researchers Harris Epsteiner and John Rico, illuminates how the proposed changes would affect different income groups across the nation. The analysis centers on two major fiscal components: a substantial $4.5 trillion in tax cuts primarily benefiting wealthy Americans, coupled with $1.5 trillion in spending reductions that would predominantly impact lower-income populations. This stark contrast forms the foundation of what researchers identify as a significant wealth transfer mechanism from the bottom 40% of Americans to the top 1%. Looking deeper into the spending cuts, the plan targets crucial social safety net programs that millions of Americans rely on daily. The Supplemental Nutrition Assistance Program, SNAP, would face a $230 billion reduction over 10 years. This program, which helps America's poorest families afford basic nutrition, serves as a critical lifeline for food security across the nation. The impact of these cuts would be felt directly at dinner tables in millions of households that depend on this assistance for basic sustenance. Even more dramatic are the proposed Medicaid cuts, totaling $880 billion over the same decade. This reduction is particularly concerning given Medicaid's dual role in American healthcare. Not only does it provide essential health coverage for low-income individuals, but it also serves as the primary funding source for 60% of elderly Americans in nursing homes. These cuts could create a healthcare crisis for both working-age Americans struggling to afford medical care and seniors requiring long-term care facilities. The researchers' detailed analysis of income distribution changes reveals a stark picture of winners and losers under the proposed plan. Households at the bottom of the income scale would experience a significant 5% reduction in their after-tax and transfer income. This metric is crucial as it represents the actual money households have available after paying taxes and receiving government benefits such as Social Security, Medicare, and unemployment benefits. The middle class would see only minimal gains, with a modest 0.6% increase in after-tax income. However, the top 5% of households would enjoy a substantial 3% boost in their after-tax income. Perhaps most telling is the researchers' finding that more than 100% of the net fiscal benefit would accrue to the top quintile, meaning the wealthiest 20% of Americans would receive more than the total net benefits of the entire plan. The proposal includes another significant element: the renewal of expiring provisions from the Tax Cuts and Jobs Act of 2017. This aspect is particularly noteworthy as that legislation was already characterized as the largest transfer of wealth from poor to ultra-rich in U.S. history. The new proposal would effectively extend and amplify these wealth redistribution effects. A political dimension adds another layer of complexity to this analysis. Despite former President Donald Trump's repeated promises not to cut Medicaid, independent analysts have concluded that Republicans cannot achieve their proposed budget goals without significant reductions to this program. This disconnect between political rhetoric and fiscal reality has already sparked protests in various parts of the country, highlighting the public's concern over potential cuts to essential services. The scope of these changes becomes even more significant when considering the number of Americans who rely on these programs. SNAP currently helps feed over 40 million Americans annually, while Medicaid provides essential healthcare coverage to more than 80 million people. These numbers underscore the massive real-world impact these budget changes could have on American families and individuals. The Yale researchers do include an important caveat in their analysis. The budget framework they examined could undergo significant modifications before becoming law. The House resolution passed on February 25 doesn't specify exactly how each committee should meet its targets, leaving room for potentially substantial changes to the specific policies they analyzed. This flexibility in implementation means the final impact could differ from their current projections. The timing of this analysis is particularly relevant as it comes during ongoing national debates about federal spending, debt limits, and the government's role in providing social services. It provides concrete data to inform these discussions, demonstrating how broad policy decisions can have specific, measurable impacts on different segments of the population. These findings raise fundamental questions about fiscal policy priorities and their impact on economic inequality in America. The proposed changes would represent one of the most significant shifts in how government resources are allocated in recent history, with substantial implications for both ends of the economic spectrum. As the nation continues to debate these crucial economic policies, the Yale analysis provides valuable insights into how budget decisions can reshape the financial landscape for millions of Americans.